Hi, I'm Kentaro Suzuki. I work predominantly out of the Ventura office, and I specialize in sports medicine and arthroscopy, mainly focused on the knee and shoulder. I grew up in Pasadena, California. I lived there pretty much my entire life until I went to college. I've always felt Southern California is home for me, and that was one of the reasons I wanted to return. So I went to college at Harvard and then did pretty much most of my medical training down in San Diego. So I went to UCSD for medical school and stayed there for residency. And then I went to Kaiser in San Diego for fellowship before moving up to the Ventura area. I think one of the main reasons I wanted to become a doctor was because it was a natural mix between interacting with people and the kind of sciences as well. And so I wanted a mix of that, and I'd had some experience with medical issues and things like that in the family, and spent a lot of time in the orthopedist office when I was growing up. So I predominantly specialize in sports medicine, so kind of a whole variety of athletic injuries, but that can range from super young athletic injuries to there's no age range or age limit to athletic injuries. But I also treat a lot of knee and shoulder issues, predominantly in the knee, predominantly meniscus injuries, ACL tears, ligamentous injuries, cartilage lesions, in the shoulder, rotator cuff tears, shoulder instability, and a variety of other things. I would say my philosophy of care is to treat the individual patient and try to tailor their overall program or treatment based on their goals and their individual conditions. I tend to try to aim towards the most conservative treatment first and try to find a treatment that's going to help people in that realm, with surgery being the last resort if people can't get better or there's no other good solution. I spent a fair amount of time in the orthopedic office growing up. I broke a number of bones. My sister had a couple scoliosis surgeries, so unfortunately they did know our name in the orthopedic office. More recently, I've had to have finger surgery when I was a resident, and a couple years ago I actually had to have back surgery for a disc herniation. So I've had to unfortunately experience the other side of the physician-patient relationship, which I think does provide some insight being on the other side as well. So currently I enjoy spending time with my two young children and my dog and my wife. We like to do a variety of things which have been much more tailored to the kids over the years. So for example, we just went to a kids musical concert with a YouTube character. When my wife and I are alone, we like to travel and sometimes go to concerts and things like that. And I enjoy playing with my dog as much as possible. I chose Ventura Orthopedics because I felt there was a real family atmosphere when I came to interview and look around. I think that the advantages of Ventura Orthopedics are that we have integrated services, and you can pretty much have everything done in the orthopedic realm through Ventura Orthopedics, including physical therapy and MRIs. And so it's nice to be able to talk to the individual therapists that are taking care of my patients, and it's nice to be able to talk to the radiologists that are reading the MRIs. And so I think that integrated nature was one of the major decision makers for me, as well as just the general family atmosphere. And you can see that when you walk into some of our offices.